Hello, everyone. This is Alraies from RSH 2025. I'm really privileged to be with Dr. Antonio Frangieh, is one of the faculty at the 2025 third edition of RSH. Antonio, thanks for being with us.
Thank you for having me.
Yeah.
Thank you.
Antonio, so this is my first time, but I think also you go to multiple conferences, structural conferences. So tell us about your experience for the RSH in general.
Yeah. Thank you, Shadi, for having me. Being here in Riyadh is a great pleasure for me. It's a great place, nice venue, great people with their kindness, their hospitality. But that also reflects a little bit the growth of the structural heart field in Saudi and also the region, and it's well reflected through the local faculty, their interaction with us, and and you can see how much they are pushing their programs forward. It's my first time here in Riyadh physically. I was part of previous sessions of the Riyadh Structure Heart, but virtually, and it's great to be here in this beautiful place. The session is the conference in all is unique because it has a comprehensive scientific program,
Yeah.
and the interaction between the local faculty and operators from Saudi, from the region, with the international. Like we came from the US, from Europe. It's amazing. And there is a lot of focus on education. You can tell it. I was part of the first day was an education course for young cardiologists, and that's huge. There was two sessions, one on TAVR and one on mitral and tricuspid therapies. There's a lot of focus on imaging as well. In addition, in parallel to the conference in the main arena, we have the training villages, and these has a lot of hands-on sessions. Again, imaging and procedural. So it's great.
Yeah. So the need for structural conference, I think it's time for the region because it's nice to have its own venue compared to coronary and imaging and stuff because structure becomes so big. And I think this is a timely conference to accommodate all these new technologies, especially with the new evidence for low risk and tricuspid valve and others.
Absolutely, I totally agree with you. Having a format, a venue where structure heart team comes, it's different from having also the coronary work or so here we have the imaging cardiologists who usually didn't used to come on our regular coronary conferences, right? And on the other side, there is the cardiac surgeon, the interventional surgeons as well, plus the dedicated cardiologist, and more we have more also the heart failure specialists. So structural heart is growing to the point that it has multiple players. I was in a session that had an electrophysiologist from Saudi, talking about pacemaker after TAVR as well. So imagine how much we really need the focused sessions for structural heart like this one, and we shared what we do. Some technologies they are available in some European countries, and definitely in the US they are not yet in the region. It will come, but that was reflected through some live sessions as a live cases. And these live cases were either from Europe and also from the Gulf area, from the region. That's amazing. I was really impressed.
Absolutely. Well, Dr. Frangieh, thank you so much for sharing your experience and being part of this great venue since the beginning of the journey of the Riyadh Structural Heart.
Absolutely, it's my pleasure.
Watch these videos and others on the YouTube channel and also on the website. This is Alraies coming to you from RSH 2025. Thank you so much.
Thank you.